I'm going to handle a very delicate topic today, and that is denial. So, I have been there. Let me say that first. As a parent, I was there. I struggled for a short time with some denial of some behaviors I was seeing, like, this is not typical. This is not what I would normally expect to see in a young child. And I kind of denied that. I kind of brushed it off. I kind of pushed it to the side. Some of these red flags were going off in my mom brain. My mom intuition was telling me something was up. And I just kept brushing it off. I kept pushing it to the side because I was kind of denying that there could be something else going on here. It's very, very common in families of someone with autism. It may be even for someone who is autistic themselves, they may struggle with denial of some things. But my point to all of this is, and I say this very open-hearted, again, I've been there. I do not want to appear judgmental to any parent or educator or doctor, anyone that's involved in the setting, but specifically parents. Being in denial is not going to help. If there truly is a challenge, if there truly is a struggle that your child is dealing with, whether it's autism or not, but specifically since I'm discussing autism, if you're seeing things that indicate that there's an issue, that indicate that there may be a struggle or an underlying problem, or if you see delays, you being in denial about that is not going to help the child. Now, you may need to take some time for you to mentally and emotionally, and sometimes even physically, kind of get things together in order to be able to address whatever delay it is or whatever challenge or struggle you're dealing with. But staying stagnant in denial when the child continues to regress and continues to fall farther and farther behind with developmental milestones and social skills and language skills and whatever else struggles you're seeing, if you sit in denial and you sit back and you act like it's not there and you act like nothing's going on and there's no reason to be concerned whatsoever, or you refuse to have the child evaluated, you can step back and actually cause them to get further and further behind, and the problem's not going to go away. So I'm not trying to, belittle anyone or say that they're wrong for sitting back and watching. And I'm all for being very observant. And I do not want to push someone to say, you've got to go right now and, get an evaluation. But I try to delicately address this when parents reach out to me and they're describing some very concerning behaviors. Not that anything's broken or anything is wrong with their child, but when we continue to sit back and try to ignore these milestones that are being missed, we're only hurting the child. And that's when I had to turn around as a parent, is I said, okay, I really don't want there to be an issue. I really don't want to have to put my child in therapy. I don't want to put a label on this, but my child needs help. There's some things that he is struggling with that I don't know what to do. And I want him to gain the skills he needs to be as successful and whoever he wants to be when he gets older. And I don't want to hold him back. And that's the moment, very defining moment for me as a mother, when I said, okay, it's time for me to get on board with this, whatever it takes. We're going to find someone to evaluate him that can give us a professional opinion and someone that's knowledgeable. And I made sure before we went for that evaluation that I trusted the individual that was going to do it, that I knew that they knew their stuff, so to speak, that they were experienced in this field. And I knew when I walked away from that appointment, whatever the individual said, I knew that I could trust it. I knew that they were going to give me an honest, educated, and well-trained diagnosis or evaluation of what we were seeing and the plan for us to take at that point. So again, I say this open-hearted. I do not want to be offensive to anyone about this. I was there, but I just challenge you not to sit back in denial and not to struggle with that so long that your child continues to get further behind. Sometimes we just have to step up and say, this is hard, this is not what I want, but it's okay. We're going to make this work. We're going to give my child whatever tools he or she needs to be successful. And sometimes we have to step back as an adult and say, I've got to make some changes, and I've got to look at this objectively and say, this is what needs to happen. So I encourage you to do that. By all means, again, reach out if you want to talk to me about those things. And again, I hope I have not been offensive. That was not my intention at all. I just want to encourage you in those moments of denial and encourage you to understand that every parent struggles with denial when it comes to their child not meeting milestones. Every one of us struggles with, why is this happening? What can I do? Is there anything that I should have done differently? And so we kind of deny those things, but ultimately we can think about that as long as we want to. But the biggest first step is trying to help that child get caught up if we can.